Someone in your circle got bitten by a tick this summer and nobody told you. 1 in 5 ticks carries disease. First, understand this. A tick is not an insect. It's an arachnid, related to spiders and scorpions. And through every stage of its life, it needs blood to survive. That's where the danger begins. A tick doesn't jump from trees. It doesn't fly. Its hunting method is much quieter. It climbs onto a blade of grass, a leaf, or a low branch, stretches out its front legs, and waits. This behavior is called questing, waiting for a host. And that's why a simple walk along a trail, working in the yard, or hiking with your dog can become the moment of contact. The scariest thing about a tick bite is that you often don't feel it. Its saliva isn't just a liquid. It's a biological cocktail designed to help the parasite feed for hours, sometimes even days, while you notice nothing. Think of a tick as a tiny biological syringe moving between species. It may feed on a mouse, then a bird, then a deer, and finally a human. A tick doesn't create disease, it carries it. If it picks up a pathogen while feeding, it can pass it on later when it bites again. And that is what makes ticks so dangerous. They are not just feeding. They are connecting wild animals, hidden infections, and people in one silent chain. One of the most dangerous things about ticks is co-infection. The same black-legged tick that carries Lyme disease can also carry other pathogens, like Babesiosis or anaplasma. And only later, the person remembers the walk. In the United States, tick risk is not spread evenly. Black-legged ticks, Lone Star ticks, American dog ticks, and Rocky Mountain wood ticks all live in different regions and carry different pathogens. Babesiosis is less well known than Lyme disease, but for some people, it can be even more dangerous. This is not a bacterial infection. It is caused by a parasite, a microscopic organism that enters red blood cells, the same cells that carry oxygen through the body. In the United States, the most common species is called Babesia macroti. Many people may have no symptoms at all, but when babesiosis does appear, it can feel like the flu: fever, chills, sweating, headache, body aches, fatigue, and nausea. The real danger is what happens inside the blood. The parasites can destroy red blood cells, leading to a condition called hemolytic anemia. That means the body starts losing the cells it needs to carry oxygen. For healthy people, the illness may be mild, but for others, the risk can be much higher. Especially older adults, people without a spleen, cancer patients, or anyone with a weakened immune system. In severe cases, babesiosis can lead to blood clotting problems, kidney failure, liver damage, confusion, respiratory distress, and in rare cases, death. And there is one more reason this disease matters. It is spreading. CDC has reported a significant rise in babesiosis cases in several northeastern states, including Maine, New Hampshire, and Vermont, places that were not always considered major babesiosis hotspots. So while Lyme disease gets most of the attention, why are we hearing more and more about ticks? One reason is climate. Longer warm seasons, milder winters, and changes in rainfall can help ticks stay active for longer and expand into places where they were once less common. Climate is not the only reason, but it changes the rules. Ticks can survive in new regions, appear earlier in the year, and stay active later into the season. The second reason is land use. As forests return, suburbs expand, and deer populations grow, people are living closer to the animals that help ticks spread. And that means one thing: more chances for humans to come into contact with infected ticks. Ticks should be removed as quickly as possible because time matters. The longer a tick stays attached, the more chance it has to pass germs into the body. For Lyme disease, infected ticks usually need to be attached for more than 24 hours before transmission happens. That is why every hour counts. Finding and removing the tick early can greatly reduce the risk. A tick is tiny, but the danger it carries can be life-changing. So check yourself, check your pets, and never ignore the bite. If you want more real stories about nature, infections, and hidden dangers, subscribe.